Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. I'm very excited to introduce our guest today as we speak about hospice care. Tad Helms is the Vice President of Business Development at Crossroads Hospice. Tad has many years of professional experience within the healthcare industry and has a passion for hospice. Tad, I want to welcome you today.
Well, thank you.
I am very excited to be talking about hospice. It's not always the favorite subject for people, but I think it's the most unused and unexplained benefit there is out there. And I think it's important that our listeners know about it. So, Ted, what is hospice exactly?
Hospice care is care provided for someone who's in a final stage of an incurable disease, in which their life expectancy is about 6 months or less. The goal is to take a holistic approach at medicine and to help provide comfort with a team of doctors, nurses, CNAs, social workers, and chaplains. Hospice care is a profession in which we don't try and cure the disease, but instead we try and treat the patient and the symptoms that they have to give them quality of life.
So, Dad, you're telling me that I have to die within 6 months?
No, ma'am. Not at all. The body does miraculous things. What happens is on a piece of paper, a cancer diagnosis, a congestive heart failure diagnosis, that qualifies that person no matter what happens once care is initiated.
So I guess then I can recertify.
Yes, ma'am. There's that every 90 days in the beginning, you'll meet and recertify, and then slowly after more and more benefit periods that'll change, and then the certified period will decrease to 30 days, and then from there it never changes after those 30 days.
Awesome. So that means I could be on for quite a while and have a better quality of life while I'm on it.
Yes, ma'am. We've had patients who have been into their 22nd benefit period, been on service for a year and a half. There's really no limitations for how long a patient can be on hospice care, as long as they continue to qualify.
Now, who is best suited for the hospice care? I mean, what's the best scenario?
So a patient who is best suited for hospice care is someone who wants to forego aggressive treatment. And aggressive treatment in certain instances is maybe a cancer patient who is receiving chemotherapy, or it may be something as simple as a congestive heart failure patient who sees their cardiologist once every 6 months. That's considered aggressive treatment. So if your goal is in line to be comfortable and change to a more quality focused life, that person would be someone who would want to be on hospice care.
So to understand this, if I have congestive heart failure and I no longer want to seek aggressive treatment, I can go on hospice. But what if my gallbladder goes out and I need treatment? Do I not get treatment?
That is something that would be considered unrelated to hospice care. So you can pursue your gallbladder and the things that you would need to make sure that that's taken care of.
And still be eligible for hospice?
Yes, ma'am. With it being unrelated, you can pursue quote unquote aggressive treatment for that while still maintaining the care team that hospice provides for you.
And I think that's very important for our listeners and us to understand that just because you're on hospice does not mean that you're not going to receive care if something else happens that you can get care for. What are the financial options for patients needing hospice care?
So when it comes to Crossroads Hospice, hospice care is always provided at free of cost to the patient, whether that's if they have Medicare, Medicaid, private insurance, or VA benefits. And just because you might be an unfunded patient or have a private health insurance that doesn't necessarily cover what Medicare would cover, you're not expected to pay that difference. And we won't limit any parts of the disciplines within our team to your care as well. Hospice care is supposed to be not burdensome to the family. So financial is one part of that. We don't want that to be the case where you have to worry about if you're going to make this payment for a hospice. Hospice is always supposed to be at no cost to the family.
So it also covers some of your medications also, doesn't it?
Yes, ma'am. So not only do you get the care team of a physician, a nurse, a CNA, a social worker, and a chaplain, but you also get added benefits of transportation. If you're leaving the hospital and you're going home and you're going to have hospice put in place, the transportation to get you home is covered. The pharmaceutical needs in which they relate to hospice is also covered. Supplies like diapers, wipes, chucks, and gloves also within hospice, and as well as durable medical equipment. So if you want a hospital bed or a bedside commode, all of those things are covered under the umbrella of hospice. It's not just the physician.
So what if I feel short of breath and I don't qualify for oxygen? Is that covered too?
Yes, ma'am. Oxygen is covered under durable medical equipment.
And that is delivered to me. I don't have to get family to take off work to go pick up my medicine or anything like that, right?
No, ma'am. All of the care is provided to you. All of the equipment is provided to you, and all the pharmaceutical needs are provided to you wherever you might reside.
That's a great benefit because
Yes,
it's
ma'am.
unlike home health. With home health, they don't cover any of that, and you're restricted as to where you can go to receive your benefits. So if I want to go to bingo and I'm on hospice, can I go?
With notifying us that you're going, that can definitely happen. Yes, ma'am. As long as you have a safe way of getting there and back, and our team is notified that if during the hours of so and so to so and so you're at bingo, we're totally fine with you going to bingo, and you should definitely have fun while you're there.
So I can do just about anything I want that is physically possible while I'm on hospice.
Yes, ma'am. Our goal is not limit you by any means while you're on our care. Our goal is to provide you comfort while you live out the rest of your life.
That's amazing. So everybody kind of hears the word hospice and cringes because I've heard it called the dying benefit or anything else, but it sounds like it can also be a quality of life benefit.
It is
And
very much a quality of life benefit. Yes, ma'am.
so do y'all offer this to veterans also?
Yes, ma'am. That we do. We actually have a handful of veterans that are currently on our care right now. Last year during COVID, we also made sure to know that the veterans that were on our care were appreciated. We made home visits in the proper PPE to show them that we appreciate what they did for our country.
That is a good deal. And it's also good to recognize our veterans. They have done an exemplary job. So we talk about illnesses, we talk about hospice care, and we talk about palliative care. Can you kind of put that together for me?
Yes, ma'am. So palliative care is one of those things that I don't think really everyone knows the difference between the two. And there is a little bit of difference. While the objective of both hospice and palliative care is to provide pain and symptom relief, the prognosis and goal tends to be different between hospice and palliative care. While palliative care, people don't necessarily have to have that exact same terminal illness like hospice does. You know, a patient can be diagnosed with a chronic, serious illness and receive the palliative care benefit and improve their quality of life. Both are aligned with the goal of symptom management and treating the patient, but the difference is palliative care treats the disease too, where hospice care decides to treat just the patient.
Okay. So what would palliative care fall under?
So palliative care is this bridge between home health and hospice, where you're still wanting some forms of aggressive treatment, but also needing more care at a higher level where it almost falls under hospice. The difference is that palliative care can be done at an earlier stage than hospice care can be done.
Okay. So how do I find a doctor that does hospice care?
Well, that tends to be easier to find than you would think. Physicians, most of them are, in some way or form, geriatric physicians are involved in some form of hospice care, whether they are directly a attending physician of a hospice or they partner with a hospice company to provide that level of care through their practice. I think the best way to look at it as all physicians are in some form or a matter connected to someone who can help provide that hospice care, that physician.
So if I go on hospice and my doctor does not want to see me or follow me, do I not get a doctor, or Do y'all have doctors available?
We have 4 doctors that are available. Other hospices have different numbers when it comes to that, but the hospice medical director can become your attending and provide that more intense level of care as the physician for them. So one of our doctors, he has this mentality of actually being very hands-on with the care. So where your primary care physician who doesn't want to follow you anymore, maybe you see them once every 3 weeks or just every time you're sick, which doesn't necessarily happen often. Our doctors go and make a face-to-face visit so that way our patients are completely understanding of the care that they're going to be providing. And it doesn't hurt to have a doctor tell you this is what's going to be going on and explaining the plan of care.
Do I have the choice to get off of hospice if I choose not to stay on?
Yes, ma'am. So whenever a patient signs up for hospice, none of those forms are actually contract binding. Surprisingly enough, they're all just consent forms allowing our care team to be in place. At any point during the care, if a patient goes, I don't see the added benefit of having hospice in place, or if they just wouldn't qualify anymore, that would also be another route that they would go of getting off hospice. But at any point, all it takes is a notification to our team to let them know that you wanted to maybe continue to go see aggressive treatment, or you just didn't want us to come by. All it takes is a phone call, and then all of our services are gone until you need us again, and then we can reinstate care at any point.
I'm on hospice and I'm dealing with my own mental feelings about where I am in my health and getting ready to say goodbye. And my family is wanting to talk about it or look at me or in a certain way. Do y'all have people that help kind of talk to the family to kind of, so I'm not having to deal with it myself?
Yes, ma'am. So not only will the nurse or your specific nurse within the care would be called your case manager, that person can explain clinical needs that you might have to different members of your family, as long as we're given the permission to reach out to those members. But we also have an entire psychosocial team between the social worker and our chaplain. If there's spiritual needs or just mental discomfort in handling certain situations, we can definitely be a part of assisting with those needs, and then also providing you with additional support for you to be able to have things taken care of.
So I'm essentially going to be able to stay home.
Yes, ma'am. Our goal is for us to provide care for you at home. All the care would be provided in your home.
What if my family can't deal with that towards the end?
So we have a handful of different avenues to pursue on that, whether it's one of those situations where the family can't physically be in the home to provide the care and our nurse provides that care. If you have a symptom that can't be managed, we can put something called continuous care in place, and that's a nurse at your bedside. Or we have contracted facilities that we work with. So what we could do is provide respite stay through a facility. That's one of the avenues that we can do, where we will make sure that you are safely transported to a facility that has a nurse there 24/7 to provide the care. And we will assist with that while your family is dealing with other things, whether there's a dynamic or anything like that. All the way to, if it gets too much clinical going on there, then what we can do is we can do a general inpatient stay at a hospital as well, where that patient can receive hospital care while on hospice.
So it basically takes all the worry and concern away from me.
Yes, ma'am. Our goal is to provide comfort care, and that's not necessarily just medications. That's situations where the family might feel stressed or burdened, and our goal is to relieve those stresses and burdens as well.
So one thing that I do know, and it's difficult to do, but I do think it's important for our audience to understand. When you go on hospice, you've made a commitment to, I don't want aggressive care anymore. And we have a do not resuscitate in place. That means if the good Lord says it's your time, we're not going to use any artificial things to keep me alive. But I'm at home and a family member panics and calls 911. What does that do for my hospice benefit?
So to kind of dive into how we would handle that situation from the start to the finish. Our education team, the community liaisons that we have in the community, whenever we sign hospice consent forms and go over the DNR that's in place, We also make sure that they have our 24/7, 365 clinical number. That is, if any emergency were to happen, you call that number, our clinical team will assist you or physically go there and assist you through anything that you're going through. If by chance, and 911 is one of those numbers that's drilled into our head, it's an emergency, I'm calling. It'll happen. What happens in that situation is, let's say you go to the hospital. There's nothing that really needs to be done between us other than a revocation form, and you can pursue that aggressive treatment, quote unquote aggressive treatment, by being in the hospital. And then whenever you're ready to discharge, we can reinstate hospice care and you can go home with us being back in place. It's not something that we have to stop or you'll get a bill from the hospital. They supersede us in that. So at no point is that going to be a confliction.
I just wanted to bring that up because it is hard not to call 911 because that's your first impulse. But I understand y'all have people available to pick up the phone in that kind of crisis and will send somebody out.
Yes, ma'am. So what we try to do is talk to the family about having that 888 number in their phone, save it as an ICE contact in there, an emergency contact. But our nurse, whenever they go to do the admission, also takes a bright highlighted yellow piece of paper that has our number on there, and we put it on the fridge along with the DNR because we think that the DNR is an important thing to keep out in the open, to be present. It does nothing for you to being in a safe with all your other important documents. So we try and make sure that that number is readily available for anyone who might need it, and also let them know that this is the number to call if this is the route you want to pursue.
What would you say sets Crossroads apart from other hospice care facilities or programs?
Well, yes, ma'am. Our first part with that, our goal is to provide compassionate and comfort to the families and just the general community. We try to educate everybody on the benefits of having hospice as soon as possible and being proactive versus reactive. We all know the stigma that exists with hospice. The goal is to educate of the benefits that hospice really has. At Crossroads, our disciplines is what really sets us apart. When it comes to our medical directors, they tend to instill a lot of knowledge onto every one of our disciplines within our team. Our founding physician, Dr. Lee, he graduated from medical school in 1976. He got an engineering degree right before that. He worked in internal medicine with a specialization in geriatrics. Within the past few years, he is solely focused on geriatric and hospice care and is our chief medical officer. So what he likes to do is educate everybody during our interdisciplinary meetings that has all of our disciplines, the social worker, the chaplain, the nurse, the CNAs, and talks through situations with them. So that way we know how to best handle it with the family. And then as we grow our company, we've always tried to find the perfect person for the job. Our newest medical director, Dr. Marconi, has over 28 years of healthcare experience. He's over the Fort Bend and Wharton County and has been a phenomenal member to our team. He just is so full of knowledge. And that's our goal with our company, is to find people to educate everyone.
So, Ted, do I have a choice to pick the hospice company I want myself or my family to use?
Patient choice is something that everyone has. You are allowed to use whoever you want for your care. At no point is that something that can be chosen for you.
So, a lot of times we kind of know ourselves better than anybody else knows us. And if I feel like I might be ready for hospice and my doctor says, no, I think we ought to wait a little bit, you're not even close, what are my options there?
Honestly, educating yourself on your own situation is a big part of that. Knowing that you have the ability to reach out to us at any time, whether there's a doctor order or not, to receive education and just knowledge of what we have to offer. It's our goal to make sure that you're qualified. It's not your goal to make sure you're qualified. So if you want to call us and ask about our company and ask about what we have to offer you, that is 100% something you can do, whether your doctor is willing to have that conversation with you or not. Our goal is to make sure that you are aware of what we have to offer, and making sure that you're going to be taken care of.
That is great. And I'll have to tell the audience that I've had the opportunity to meet Tad and his group of people. And hospice is very close to my heart. I've used it with my parents and family in the past. And when you can get the hospice benefit in early, it is so much easier for the patient and for the family who's on the other side of that. You won't find a more compassionate group of people. I was very impressed with them. And I picked this subject to talk about today because we are in an era where we have not dealt with so much death and unfortunate things going on with COVID and stuff. And this is a great benefit to help give you support. And Tad, if I'm not mistaken, it doesn't stop once our loved one passes.
No, ma'am, it doesn't. Whenever we're providing clinical care to the patient who's on our service, we also do provide care in a supportive manner to anybody who's a part of that patient's care. And whenever that patient passes away, it doesn't mean that you can't still call us, talk with us, that nurse who was super close to your loved one. A lot of the times we found that our nurses get invited to go to the funeral of that person. They build relationships. It's a very intimate moment that we all go through. And at any point, that person who went through that intimate moment with that family is there for that person.
I know that this is a difficult subject for some of our listeners, but I do hope that they've been listening because it's something we'll all have to deal with in one way or another. I do believe knowledge is power. And if you can give some forethought into this, this is a tremendous benefit. Tad, is there anything else you'd like to share with us?
As I was going through things, I think it's one of those right now, having the benefit of trying to avoid the hospital is just something that I just wanted to double down on. With everything going on in the medical field that we have today, being able to provide care within the home and not having to have your loved one go to the hospital for something that might not necessarily be that intense of a case where it's hospital necessary. We provide things from mobile x-rays for a patient who had a fall at a facility to making sure that a patient gets stitches if they had a skin tear. Simple things like those help us keep patients out of the hospital and keep the hospital doing what it needs to do without going in there and dealing with all that. It alleviates a lot of stress having us to be able to provide in-home needs such as those.
Ted, you've been a source of information today, and I hope our viewers have appreciated all the information we have. We will give you Crossroads number and how to get in touch with them. If you have any more questions, I have found them to be full of information and very open and honest with answering their questions. Tad, I want to thank you for joining us today, and a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.